Hi everyone, my name is Zoe Poucher and I'm a PhD candidate studying the mental health of elite Canadian athletes. Today I'm really excited to present some of the data from my doctoral work, which identified the prevalence of 3 common mental disorders among Canadian athletes who are training for the Tokyo Summer Games. I would like to thank my supervisor, Dr. Tamminen, and the members of my committee, Drs. Sabiston, Kerr, and Cairney, for their guidance throughout this project. I'd also like to thank SSHRC and Sport Canada for funding this research. So as researchers have started to study athlete mental health, they've found that rates of mental disorder among elite athletes are similar to, or in some cases higher than, members of the general population. Sport-related stressors, including injury, poor performance, retirement, may account for these higher rates of disorder. Despite the increase in research on athlete mental health, we still know relatively little about the mental health of elite Canadian athletes, and research on the mental health of elite athletes from other countries may not be generalizable to a Canadian context because elite sport environments can vary substantially between nations. Therefore, the purpose of this project was to identify the prevalence of symptoms of depression, anxiety, and eating disorders among elite Canadian athletes at 4 times over the course of a pre-Olympic and pandemic year, and to compare the prevalence of disorder symptoms based on a few key athlete characteristics. To do this, Canadian athletes who are preparing for the 2020 Games completed 4 online surveys that assessed gender, Olympic or Paralympic status, use of a Canadian sports centre, and symptoms of depression, anxiety, and eating disorders. These surveys were completed in December of 2019 and March, June, and September of 2020. Once the surveys were complete, data were analyzed using descriptive statistics and chi-squares. Between 37 and 41% of the athletes we surveyed met the cutoff criteria for 1 or more mental disorders at each time point. Symptoms of depression were most common among athletes at each time point, with between 10 and 17% of athletes meeting the criteria for depression based on predetermined cutoff scores that are informed by the DSM-5, and symptoms of depression and anxiety were the most comorbid of the 3 disorders. Across the 4 time points, more women than men met the criteria for anxiety, and this difference was significant at 2 time points. A significantly greater percentage of women also met the criteria for eating disorders when compared to men at all 4 time points. And lastly, there were no major differences in depression, anxiety, or eating disorders between Olympians and Paralympians, or between athletes who did and did not train at a Canadian sports centre. The findings from the present study are consistent with previous literature, which indicates that athletes may be at an increased risk of experiencing a mental disorder compared to the general Canadian population. About 20% of people in the general population report experiencing a mental disorder over a 12-month period, compared to approximately 40% of athletes in the present sample. The findings are also consistent with the limited research that does exist on the prevalence of mental disorder among elite athletes from other countries. For example, Gulliver and colleagues found that approximately 46% of the elite Australian athletes they surveyed met the criteria for at least one of the 6 disorders they assessed, which included psychological distress, depression, general anxiety, social anxiety, panic disorder, and eating disorders. The findings also indicated that there were no significant differences in the rates of disorder between Olympic and Paralympic athletes. This could indicate that both groups of athletes experience similar stressors based on their sport participation, such as worries about team selection or funding, which may have led to similar rates of disorder. There were also no significant differences in rates of disorder between athletes training at different sports centers across the country. One reason for this could be that the sports centers are offering similar types and similar levels of mental health support to their athletes. It is important to note, though, that the number of Paralympic athletes and the number of athletes training at some of the support centers in the present sample were pretty small, which made it somewhat difficult to draw inferences from this data. The results also indicate that female athletes may be more susceptible to experiencing certain disorders than their male counterparts, and this is reflective of research among both athlete and non-athlete populations. So this information might be helpful in designing mental health interventions, which could be targeted specifically to support the different needs of male and female athletes. And given the cancellation of the Olympics and the Paralympics and the challenges posed by the COVID pandemic, these findings provide insight into the mental health of elite Canadian athletes over the course of a really stressful year. So this information may be valuable moving forward for understanding the impact that really high levels of stress can have on athletes. And this study provides some of the first estimates of the prevalence of mental disorder among elite Canadian athletes, which is important as it may lead to an increased understanding of athlete mental health. The results indicating that elite athletes may be at an increased risk of experiencing a mental disorder compared to members of the general population really highlights the need for mental health resources, interventions, and policies designed specifically to support elite Canadian athletes. Thanks so much for listening. I'm now happy to answer any questions you may have. My email address is also on the slide here if you would like to contact me later. And lastly, here are all of my references.